Now I'd like to introduce our speaker. Dr. Kim Hecht is our medical director of the Samueli.institute. Dr. Hecht earned her medical degree from the College of Osteopathic Medicine of the Pacific, where she also completed a predoctoral teaching fellowship in osteopathic manipulative medicine. Dr. Hecht completed her residency in physical medicine and rehabilitation at UCI. In addition to the conventional biomedical approach, Dr. Hecht blends a broad range of complementary healing modalities to assist her patients through lifestyle recommendations, hormone replacement therapy, osteopathic manual therapy, prolotherapy, and platelet-rich plasma injections. Today, Dr. Hecht will be discussing an introduction to regenerative injections for pain.
Thank you for being here and joining us this afternoon. I'm really excited to present to you guys the benefits of prolotherapy and platelet-rich plasma injections for musculoskeletal conditions. Today, briefly, I'd like to just give you a broad overview of the idea of why we choose to do these injections for musculoskeletal issues. So in reviewing anatomy, a little physiology, I think that will help you to understand why these types of injections might be beneficial for you. So we'll be talking about your body structure, what happens to it during injury and the healing cascade, and then the role of different types of regenerative therapies. So the first thing about the body structure is I would say to you that our body has some similarities to the Golden Gate Bridge. So in this picture, you can see beautiful San Francisco and the Golden Gate Bridge. Now there are some steel towers. There's two steel towers that kind of the wires and cables attached to them. And then you have the road. So the steel towers kind of act similarly to our bones, and the cables that are attached to it act like our tendons and muscles. So this idea of tensegrity is that the stability of the structure depends on the balance of the tensile elements like the cables and the compressive elements like the steel towers. I gave another example of tensegrity structure on the right. So if we look at our body, and this is an individual on the left bending forward, the different muscles in your back actually support your spine. And, you know, as we bend over, there is going to be increased tension on our back that is modified through the tendons and ligaments and muscles. On the right is a model of how tensegrity would kind of look like in the arm. So again, if you look, you know, the bones, it's kind of similar to the steel towers in the Golden Gate Bridge. And then where the muscles and tendons attach at the shoulder, elbow, and wrists, those would be like the cables in the Golden Gate Bridge. So why am I talking about tendons and ligaments? Well, they typically get injured a lot during activity. And one of the reasons is that, you know, there is less oxygen use in tendons and ligaments. It's actually 7.5 times less than in muscles. And our body was made that way so that the tendons and ligaments could actually hold tension for a prolonged period of time without the risk of ischemia or lack of blood flow. But because there is a lack of, you know, a lower metabolic rate in tendons, that also results in slower healing than muscles after injury. Furthermore, the sad fact is, as we age, our tendons and ligaments will develop less elasticity, less strength, there's less collagen turnover, and less blood flow to the tendons that can contribute to degeneration of the tendons and ligaments. All right, let me just quickly go back to the pictures. So when I first talked about the Golden Gate Bridge. Hopefully you can see it now. That the cable towers are kind of like our bones. And I mean, the steel towers are like our bones. And the cables are like our tendons and ligaments. And then here we have a model of a person bending forward. And as they bend forward, there is going to be more stress on the back. But that is relieved through the tensile elements in the muscles and the ligaments. On the right, we see a model of the arm as a tensegrity system. So you can imagine that the bones are kind of like the cable towers in the Golden Gate Bridge. And then, you know, where the muscles and tendons attach, those are like the cables. So just briefly again, tendons and ligaments are going to be more prone to injury because they have less blood flow to them. And they have less of a metabolic rate compared to muscles, so they are not going to heal as quickly as muscles after injury. As we age, the tendons and ligaments will have decreased elasticity, strength, and there's also going to be less collagen turnover. So, and there will also be less blood flow as we age to the tendons that will also contribute to their degeneration. So here, these are cadaver models. And on the left, you can see the Achilles tendon of a young adult person in his or her 20s. And on the right, you can see the Achilles tendon of an older adult. So you can see that the collagen bundles do not look as full on the left as they do on the right, and that there is a lot of degeneration. And so, you know, during my time working with patients, my patients in, you know, their 50s and 60s be like, you know, I used to run 10, 20 miles in a week very easily and have no problems. Why is it now in my 50s and 60s that, you know, I can run for a little bit, but then I'll start having more aches and pains? And so, as I mentioned before, our tendons and ligaments begin to degenerate in our, they actually begin to degenerate in our 30s and 40s. And you can see these as clear examples here on the right. So there are different ways that our tissues become injured. If we don't move and we become sedentary, there is going to be less turnover of collagen fibers. And so that can also lead to more degradation of the tissue. On the right, people who overwork their tendons and ligaments, there may be high turnover, but they found that when they looked at people who had Achilles tendinitis or Achilles pain, that, you know, their collagen was already disrupted. Those people have higher acid in that area, and there may have been some micro ruptures because the tendons and the ligaments don't have as good of blood flow. That will contribute to the degeneration. So what happens if you injure your tendons and ligaments? Well, in general, they say the healing occurs in 3 phases. So the first phase is inflammation, and it begins immediately after an injury. And that is where, one second, you have red blood cells. There are other inflammatory cells like neutrophils that come into the area, try to clean up any debris, bacteria, and then they initiate the start of blood vessels to be formed. And that's during the proliferation phase, which begins after a couple of days. So that's where macrophages try to initiate new healing in the area, and the blood vessels proliferate more, and your body tries to bring in stem cells to the area as well. and those cells would differentiate into the types of cells that is around that area. At about 6 weeks, your collagen tissue will begin to be resized and reshaped, and things will start to mature at around 10 weeks. There might actually also be fibrosis of the tissue at that point. So this is just a graph of showing the inflammatory phase at the beginning. Then you have the formation of some new tissue, and then after that, the tissue begins to remodel and mature. So the platelets have a very important role in healing. And normally when we hear about platelets, we think about blood clots. But platelets are a very important part in the beginning of that inflammation process. In this graph, you can see some platelets, they're going around to plug up a wound. And there are some granules inside of the platelets called alpha granules, and they store growth factors, cytokines, proteases, that when they are activated, they release those different factors so that the body can initiate the healing response. So what is the role of regenerative medicine? Well, we are going to try to simulate that natural healing response and in order to relieve pain and improve function. So I won't be talking about all of the different types of regenerative therapies. I will briefly talk about hyaluronic acid, prolotherapy, and platelet-rich plasma. I will not be discussing stem cell therapy today. So hyaluronic acid, it is a glycosaminoglycan, and it's a natural component of our synovial fluid. So you can think of it as a lubricant. And as we age, the volume and the viscosity of this fluid starts to decrease. So patients who have osteoarthritis of the knee, if they're injected with hyaluronic acid, that acts as a cushion to relieve their pain. And this is approved by the FDA for knee arthritis. In terms of therapy, it is an injection of an irritant in the musculoskeletal tissue. Most of the time, we inject dextrose. That comes from corn sugar, and that causes inflammation in the tissue to restart the healing process that I had discussed before. It is useful for ligament injury, tendinopathy, and arthritis, because as I said before, the ligaments and tendons tend not to have very good blood flow, and as we age, that blood flow decreases. So when you inject into that area, that will induce an injury to kind of restart the process. So again, just to recap, the Golden Gate Bridge has some elements that are similar to our body. The steel towers are kind of like our bones, and the cables are like our tendons and ligaments. So prolotherapy is injecting the tendons and ligaments where they connect to the bones most of the time. There are also injections into the joint spaces, but by injecting where the tendons and ligaments attach to the bones, that's where we are strengthening the area. So here are some examples of areas that are injected with prolotherapy. On the left, you can see the thoracic spine, and on the right, kind of the low back and pelvic area. I put a picture there on the right just to show you all of the ligaments that are in the area of the low back and pelvis. So there are a lot of ligaments that support the stability of this area, and if they're injured, then you're going to have less stability. Another type of injection that we do here is platelet-rich plasma. It is produced from your own blood, and injected into the affected area. So, like I said before, platelets are known to control bleeding, and the different granules within the platelets that are released, they release growth factors that promote repair and regeneration, as well as reduce inflammation. So sometimes we might not be able to send enough platelets to the area for healing. And so this process will kind of give you extra growth factors and different things that promote healing. The procedure, we collect about 30 to 60 milliliters of blood from the patient, and we centrifuge it. Once we centrifuge it, then we separate the blood out, the platelets out from the rest of the blood components, and we extract plasma as well, and inject about 3 to 6 milliliters of the platelet-rich plasma into the injured area. So here are a few examples on ultrasound. These are not my patients, but this is an example of a 70-year-old individual who had a tear in his shoulder in the biceps tendon. So if you look, you can see the white circle is around the tear, and there are some arrows pointing to where the tear is, which is kind of darker than the rest of the tendon. So the white area in general here is going to be the tendon. After 3 injections, you can see that dark area, you can start seeing tendon there now. So it's being filled and starting to heal. Another example of PRP for the elbow. This was a 33-year-old individual who played tennis and was having pain on the medial part of his elbow. And you can see where the arrow and is circling, it's dark. That's where the tendon should be, but there is a tear there. So that was before the first PRP injection. And then on the second picture on the right, you can see that before the beginning of the second PRP injection, which was done 1 month after the first injection, that the tear was healing. So this person was 33 years old, and you would think, well, this person is younger, they should be able, to heal from a tendon injury. But if you're using that area a lot repetitively, the micro trauma might not be able to heal. And so the PRP is just adding an extra element to kind of restart the healing process and initiate it again. The recovery period after injections, there might be some swelling or discomfort there for a few days. Typically, there can be significant discomfort for 2 to 3 days. Occasionally, I do give my patients pain medications for that, but they are not allowed to take any kind of ibuprofen or Advil, because that would prevent the inflammatory process to begin, because we're trying to initiate healing again. And depending on the area, it may take 2 to 8 weeks to start feeling better. Who is not a candidate for PRP? Well, first of all, a consultation is required to evaluate you to see if these types of injections might be helpful for you and your pain. But patients that generally have anemia, cancer, infection, certain blood disorders, or pregnant are not candidates for PRP, because it involves taking blood, and sometimes a substantial amount of blood. And those patients might, not the pregnant ones, but certain patients, maybe the ones that have anemia or cancer, might be candidates for prolotherapy then. So what conditions does prolotherapy and PRP treat? It treats tendinitis, which is inflammation of the tendon, tendinosis, which is thickening, scarring, or poor blood flow within the tendon, and arthritis. PRP has been shown to be helpful in knee arthritis. I've just listed some of the evidence for the efficacy of these things. In prolotherapy, for the knee osteoarthritis, It's been shown to be helpful up to 2.5 years in some patients. There's been several studies showing that osteoarthritis of the knee is benefited by platelet-rich plasma injections. One of the studies was done in mild to moderate arthritis, and they showed that 2 to 3 injections of platelet-rich plasma was helpful to a year. And in prolotherapy, TMJ, there was some benefits up to 4 years, tennis elbow up to a year, platelet-rich plasma in lumbar facets and SI joints, tennis elbow and tendinopathy. So some arthritic conditions and various, conditions that affect the tendons. And these are my references.
Well, thank you. Thank you, Dr. Hecht. We appreciate you taking the time today. We know you're busy. And for those of you that don't know, Dr. Hecht has been with the Institute for some time, but she is now our medical director for the samueli.institute and our clinic. So congratulations, Dr. Hecht.
Thank you very much. Thank you for all of the very good questions. And I would love to see any of you that have questions or want treatment for pain.
Right, thank you.
Thank you.
Yeah, you guys can call the clinic. We're doing telehealth appointments right now since it's still stay at home. So we're doing a lot of appointments just like this over video and phone as well. If you're not ready to go into the clinic, we'll be opening up probably soon at the clinic. So, and then also following today's session, we'll be emailing you Dr. Hecht's 5 takeaways from her talk today. And she's also open to sharing her PowerPoint presentation. So if you weren't able to take notes, we can send that to you as well. And we also wanted to invite you to join our Wellbeing Circle. Some of you that I know that are on the session today and have joined us are our Wellbeing Circle members. It's a donor society. It's a $1,000 annual donation. And we host 8 events just like this event, although usually in person. We do 4 lunch and learns with our providers at the Institute, and you're allowed to bring a guest for free to all these events. And it's a really great way intimately to get to know our providers, all the services they do. You can ask questions. There are different topics for each one. And then we also do 4 excursions, which usually they're with Heather Rice, our acupuncturist, who spoke earlier today. We do hikes with Heather throughout Orange County, just 2 or 3 hour hikes. We do a meditation. So it's really just to have a deeper involvement with everyone at the clinic and the Institute. So we welcome you to join us, and we'll send you some information on that as well. But we just wanted to say thank you to everybody for joining us virtually. We're sorry we couldn't have Women's Wellness Day in person this year. We look forward to seeing you all next year in 2021. Thanks so much.
Thank you.